The important things about policy issues is that it gives you an opportunity to create institutional lasting change. A lot of what we see happening is working on educating individual young people or providers talking to an individual patient. But when you work on public policy, you create systems that last far longer than organizations and that last longer than the efforts of individuals. So our work with policymakers is designed to ensure that the policies in our country make it possible for people to access the services that they need, to access the information that they need, and you can't do that kind of institutional change without working on public policy. Having policies in place that provide people access to the services and programs that they need, having policies that promote rather than prevent people from being sexually healthy is just really critically important. There's a lot of work that we can do individually. There's a role for parents, there's a role for schools, there's a role for healthcare providers, but there's a really important role for policymakers. And so we believe that it's important to be ever vigilant on the policy front so that we can create systemic, lasting institutional change. It feels pretty contentious over the last few years. It has felt much more like efforts to legislate morality were in place. It's sometimes, I think there were times when we dubbed it the war on women. Lots of battles around contraceptions and some of those kinds of decisions. Things that should be very straightforward, like an HPV vaccine to prevent cervical cancer, really become loaded, controversial issues in a way that they absolutely should not. And that's been disturbing. Well, a sexually healthy nation would be one in which we had policies in place to make it possible for people to access the services that they need, as I mentioned earlier. We would be much more comfortable talking about sex and sexuality. We would talk about it with our families, with our partners, way more comfortably than we do right now. We would not have the kind of stigma around sex and sexuality that we have right now. It would be much more normal. I mean, I see it very much along the same kind of lines that the battles that we fought around mental health a few years ago. It used to be that if someone was talking to a therapist, it was, and if you were a politician, you could certainly never mention that. But we've gotten a lot better in how we talk about mental health, and I would love to see us be able to talk about sexual health in the same way we talk about other aspects of our physical health.